we have these women that have burnt the candle at both ends for many years. They have prioritized productivity over, am I eating, moving, and thinking the way that I'm supposed to eat, move, and think? And also, respectfully, women that are in their mid-30s, they start to play with this thing called perimenopause, where the hormones start to think about menopause. They're still fertile, they can still have babies, but what happens is because of the shuttling and the movement of testosterone and estrogen and progesterone, it gets trickier. Progesterone is the brake pedal. And most of these women have been all gas and no brakes for most of their professional career. And she got to the point where she had to quit her job.
Dr. Greg, welcome to the Charlene Gisele Show. I'm so happy to have you on. I've been consuming your content for such a long time. It's so exciting for me to get to talk to you live. This feels super special.
Yeah, well, it's an honor. Most people feel like they know me out on a walk, talking to my phone, and I love to have the opportunity to dive deeper, to touch lives, and I'm looking forward to our conversation today.
Oh, likewise. Thank you so much. To begin this podcast, I would love for you to tell the folks listening who you are if they're not familiar with your content yet, and who do you do what you do for? Who do you serve? Who do you help?
That's great. I love that question. So I've been a doctor now for almost 25 years. Right when I got out of my medical training, I started treating children on the autistic spectrum. I have a huge place in my heart for kids that have things that they didn't ask for. And in that pursuit, we started running lab work. We started to look at correlations with the gut and the brain, and we started to see movement inside of these young kids. And then the moms started talking to us, and the dads started talking to us, and then that progressed into starting to serve professional athletes. I actually traveled with an Olympic gold medal wrestler for several years. I would actually run his lab work during training to see exactly what his needs were nutritionally. And then oddly enough, when I traveled with him, because of my background, my culinary background, I actually would cook all of his meals when we traveled so that he could make weight. And then I made sure that he had the right tools along the way. And then because of that exposure, we started working with other professional athletes. And then we started to get a lot of executives, a lot of high stress, high level, high demand people that said, hey, I don't love where I am, and I don't know what to do. I don't have the time to maybe do all of this stuff, but how can I trust you to, number one, do the right testing, number two, know what I need without throwing something up against the wall to see what sticks, like what do I actually need, and then to journey with me so that I know both quantifiably on the data, but also intuitively how I'm feeling the state of my nervous system, where I'm at. So who do we serve? My identity is I am here to reveal people's potential. And that's been something that's on my heart for many, many years. And so we treat a lot of women in perimenopause because that's a crazy time of life, and lots of things come of that. There's a lot of miscommunication in the medical community about what can be done or what should be done. And then just helping people understand why, because there's so much confusion online. There's so many Instagrammers and TikTokers that give this like magic cure, but a lot of them just don't work for certain people. So we're just here to serve. We're here to come alongside people, give them an unfair advantage, and allow them. I had a quote that I wrote on my whiteboard probably about 10 years ago, and it said, "We create epic family reunions." So that's that understanding of who does someone get to be down the road with those that they love and have the ability to leave a legacy.
You know, I love that you said that. And one of the things that really attracted me to your practice and your philosophy is this approach of checking things and not guessing things. I certainly don't want to be speaking badly of doctors. You're a doctor, but I really set you apart. And I hope you don't mind me doing that, because I've had quite negative experience with some members of the profession in terms of the approach being so not holistic and not proactive at all. So it's very much, here is how you feel. Let me give you a drug. Let me medicate you. And let's see if the drug works. And don't ask me about the way I sleep. Don't ask me about the way I
Yeah.
move. Don't ask me about what I eat. Let's just throw a drug to the problem. And I see this time and time again. And now that I've become a clinical hypnotherapist, I'm on the other side of the fence where I see my clients and my patients hit a wall. They go see
Mhm.
a doctor, a traditional doctor, and they're busy. They've got 10 minutes per patient,
Right.
but they just medicate the patients, and
I
sometimes there
know.
is so much more that needs to be
Yeah.
done.
I hear you. And the reality is, I mean, I have members of my family that are traditional medical people, and they're good people, but they're inside of a system that is big money, right? I mean, so for example, the research says, so like when it comes to um, emergency medical care. Like I live in the United States. The United States is actually ranked number one in the world in emergency medical care. So if I'm going to be in a country and I get in an accident, I'm in that country. And there's drugs and surgery, and they're very appropriate. Well, the same piece of research, this was done by the World Health Organization, took the same countries and looked at overall health and wellness. And the United States came in 37th out of 39 countries. And here's the reality. The understanding is Charlene, they're using the same philosophy to keep people well as it does for emergency medicine. And that doesn't work. Like the analogy that I tell my patients is, God forbid, if I go home today and my house is on fire, do I call the fire department or do I call the remodeling company? Well, I call the fire department to put the fire out, to be emergency in that standpoint. And if they did their job 2 weeks later, do I call the fire department or do I call the remodeling company? You see, fire companies have fire hoses and axes. That's the only tools that they have. But if you go to rebuild a house with fire hoses and axes, it doesn't work. But medicine, and again, when you look at even research, they're like, oh, the research shows that our stuff works. But like, what are you researching, right? So if there was a piece of research on a home and it said, we prevent exterior home fires, and our approach is to spray the side of the house with water all day long. See, no house fire. But what they fail to see is that the inside of the house is full of mold now. So when you
Yes.
look at research, we have to understand, what are we looking at? And the reality too, you're right, like 7 to 10 minutes, they don't understand what's going on. The premise that needs to be understood, and I have just shy of a PhD in neurology, is the body responds appropriately to its environment.
Hmm.
So instead of thinking of a symptom as a symptom, think of a symptom as a signal. What is my body trying to tell me?
Hmm.
As opposed to Western medicine says, oh, here's a symptom, here's a drug. Let's take away that symptom. Then the body's like, oh, I was trying to talk to you and you just shut me up. But this because there's things going on inside of my system. So how I educate people is be curious. Be curious with what your body's trying to tell you. And two, in your space, like we know in the neurological background, if your nervous system is not in a state of acceptance of the
Hmm.
ability to receive what you're doing, I don't care what vitamin you're taking, I don't care what books you're reading, your body cannot receive it, right? So if you're in that sympathetic, or actually we now know there's a dorsal parasympathetic part of the nervous system, your body's not interested. So that's why nervous system regulation has to start at the very beginning, because if not, then your body is literally looking over its shoulder all day long saying, what's out to get me? What's coming to get me? And actually, because we do a lot of work with fertility as well, think of this. If you're a woman and your hormones are off, what if they're off intelligently? What if your body says right now is not the best time to have balanced, amazing hormones, because hypothetically, if I conceived a baby right now, oh my word, that would be such a load on my body. Like I couldn't be the best version of myself. So a woman's body can intelligently, appropriately shift the hormones out of balance. And then, because some of the toughest patients we get are women who have had fertility forced upon them when the body was
Hmm.
trying to say, hey, like now's not the right time. And so that those are just examples. And it's looking at things through a different lens. It's honoring the body, honoring our neurology, honoring our past, our current, and really understanding what stress is. Stress is stress, whether, a lot of times when people think of stress, they think of like, oh, I'm so stressed out. But when I've worked with professional athletes and we do things like heart rate variability, you are overtraining, which is no different than you being in a super stressful emotional relationship, no different than you having a childhood trauma, no different than you getting in a bad car accident. Your nervous system cannot distinguish the difference. So it's kind of a bit of reframing, like taking a different view. And again, there is totally a time and place for Western medicine. And I'm grateful. Like I would actually, I would have lost my wife and our firstborn baby at childbirth 100 years ago because our baby had the umbilical cord wrapped twice around her neck. And my wife, she was not able to labor. So thank God for a C-section. And I have a beautiful 21-year-old or almost 21-year-old. And I'm grateful for
Oh,
that. So we have to understand, when is it appropriate? When's the
yes.
time and place? And also to look at the stats, right? Western medicine is not designed to keep us well and healthy.
And I'm so glad you said that because, well, first of all, I'm so grateful you shared the beautiful story about your family, and I'm glad that your wife and uh, children are well. But,
Yeah.
it's very similar to me. I wouldn't see if it wasn't for Western medicine. I had an accident when I was only 3 year old and fell off and had to have a very, very tricky eye operation. It's very hard to operate a child that young.
Yeah.
And I'm so grateful. So I think that's really important to distinguish between an intervention like house is on fire and
Right.
looking at it from a prevention. So my personal experience where I felt that Western medicine failed me, if you don't mind me sharing,
Please
is
do.
actually back when I burnt out. And I have to put it in context. Back when I burnt out, there was no World Health Organization definition of burnout. That's quite recent. That's
Yeah.
2019. So I burnt out over a decade ago. And I'll be honest, Dr. Greg, what I was told by my doctor at the time, and I don't blame him, he did the best he could with the tools he had. He said, "You're having a nervous breakdown. I'm going to prescribe antidepressant, and that should do it."
Oh,
Now, you're talking to a type A ambitious young lawyer
yeah.
who is a litigator at one of the top greatest law firm in the world. Like, A, I don't want to hear I'm having a nervous
Yeah.
breakdown.
Yeah.
B, I definitely don't want to be medicated on antidepressant. And
Right.
C, how about you ask me about whether or not I've slept for the past 3 days,
Right.
how I take care of my body,
Right.
how I eat, whether or not I use substances or anything like that. No, you just put me on antidepressant and tell me I'm having a nervous breakdown.
Yeah. No,
Not
and
helpful.
how defeating. Um,
Right.
I've had so many patients that, because people are taught, trust your doctor. They have a white coat and a stethoscope on. They've been to college for way too many years. They have your best interest. So there's this human nature that says, I want to trust people. I want to lean in. And then you go to places like that. And again, this is not all of them. This is not a bash medicine conversation, but people feel so discredited. Like you're obviously a profoundly intelligent woman. You were under mountains of stress. Your body responded appropriately, and you were told you're broken, you're damaged, and you just need some drugs and you'll be fine. And obviously, you're very logically minded, and you're like, whoa, time out here. That doesn't. But then you also have to understand, whoa, I went to the fire department and they only have fire hoses and axes. And my soul, maybe you didn't know it at the time, but your soul didn't want a fire hose and an axe. It wanted a conversation. It wanted someone to hold space for you. You wanted tips and tools and tricks to not only understand where you are, but how did I get here and how do I not go back here again? And you were let down, and your experience is so common. And the thing that breaks my heart, and I love the path that you're on. I love the journey, because I think it was like God's plan to have you be a clinical hypnotherapist. Yet, imagine how many people, litigators, attorneys, executives, are at the same place. They're listening to this right now saying, oh my gosh, that's me. Do I need to take my life's calling professionally, my giftedness, and quit?
Hmm.
Like, so there's this real battle inside of this. Or gosh, I give my very, very best in the courtroom, in the office, And respectfully, there's nothing left of me when I go home. And my spouse and my babies, like, they get the crumbs. And
Yes.
that's tough as well. So I'm grateful that you had that experience, because some of us need that dark night of the soul experience where we're like, oh my gosh, this is big. And I expected this approach to hold space for me, and it didn't. And that's the
Mm.
conundrum that so many people are inside of right now, is they go to their doctor and they have symptoms, and the symptoms are real. And because maybe the labs are off, or they're normal, they're like, hey, there's nothing wrong. And then the person goes like, wait, is this in my head? Am I just thinking this? But then as they hold space for themselves
Yes,
and they say to
absolutely.
themselves, no, I'm not okay. I'm not normal. I don't agree with let's watch and wait. It's not bad enough yet, right? So that's the tension that so many people are inside of right now. And I love that. And again, I love that you had that experience, because it gives you empathy for your clients and patients that now come and see you, because you're like, I get it. And you can hold space and you can attune with them to understand, like, I've been there.
How often do you see patients with this almost dilemma of, am I burnt out? Am I depressed? Am I both? Am I stressed out? Is this chronic anxiety? Is this general anxiety disorder? Is it all of the above? Because I feel like sometimes they can be intertwined, right?
Um, Often, because I'm not a primary care physician, I am a specialist. So typically, people have seen 3 to 5 other doctors before they stumble into my practice. And respectfully for our listeners, 95% of my practice is virtual. So I
Right.
treat people all around the world. And and what happens is they are, yeah, they've questioned, like, is this in my head? Do I actually have a chemical imbalance? Do I need medication? I'm not against medication, but I want to know what's going on. The body responds appropriately. When the body gets stressed, it has to respond to that stress. So what happens is the body will prioritize survival. So, for example, digestion is not survival. Losing weight is not survival. A sense of peace in your soul is not survival. Your body literally, like brings everything to a minimum so that you can survive. And it can
Mm.
present itself in so many ways and so many symptoms. And when people have the ability, I just got off the call with a patient before this, where she said, she's about 3 months into journeying with us in our one-on-one care, and she said, I feel peaceful. Can you explain that to me? I feel peaceful. And I said, that's a nervous system and an immune system response of your body's ability to look around and say, I'm good. I'm in a place that I am good. I can thrive. I can dream. I can tackle the day without thinking I just need to survive.
Mhm. Mhm. And I really want to talk about fertility as well, because what I'm seeing is a trend, and I would love to see if you're seeing the same trend. I have never had as many female clients come to see me because of miscarriage
Yeah.
or not being able to
Yeah.
fall pregnant in the first place. And they've often, gone through mountains in terms of trying. And what I'm noticing is the trend is like that kind of really like late 30, early 40,
Right.
high powered, career driven woman who's super stressed out.
Right.
And, naturally, she didn't have time to even think about wanting to build a family in her 20s. And here she is doing the best she can. And she's really struggling. Are you seeing that too?
Oh my gosh. Yeah, fertility is rampant right now. Even on the male side, we're seeing this drastic drop in sperm counts on guys. And so the thing that we live in a very toxic world, and I could teach a weekend seminar on this conversation, so I'll try to keep it as short as I can. So, for example, ladies, it's your liver that is actually designed to move estrogen and progesterone around ovulation, and again at menstruation. Well, what does the liver do? Well, your liver, by the way, your thyroid, 60% of the conversion of inactive thyroid hormone to active thyroid hormone, 60% of that conversion happens in your liver. Your liver has a digestive component. It is so common that women are having their gallbladders removed. And typically what I find, the gallbladder is simply a sac attached to the liver. And many times I feel that the liver will like put its toxicity into the gallbladder to say, I can't have this in my tissue. So there's a digestive component. So there's thyroid, there's digestive, and then every 3 to 6 minutes, every drop of blood in your body goes through your liver from a detoxification standpoint. So if there's system stress, like for example, we even now know they've actually done research on like placental blood, like what toxins are in the placental blood of a pregnant woman. And it is astronomical, the toxins that we're exposed to. And even for hormones to work inside of the body. So I'm not sure if this is going to be on video. Not so. Think of my fist as like a cell, and every cell has little antennas on them. For a hormone to actually work in the body, the hormone must dock on that receptor site. It's then carried inside the cell, and that's where the magic happens. Well, there's a term now called EDCs, endocrine disrupting chemicals. So people being exposed to things like molds or plasticizers or heavy metals or forever chemicals, we know that these chemicals are actually more attracted to those receptor sites than the actual hormones. Mm-hmm. So the reality is we're becoming in more of a toxic world. We're also tapping our nervous system. So for step one is we have receptor sites that are not very receptive to the hormones. We have these women that have burnt the candle at both ends for many years. They have prioritized productivity over, am I eating, moving, and thinking the way that I'm supposed to eat, move, and think? And then there's this ask of like, hey, let's have a baby now. And the body's like, say what? Like, I thought we were a racehorse and now you're asking us to like have babies. Like, so there is this, and then there's the emotional part of it. Right. So many of these women potentially were like, my career. I'm identified by my career. I'm identified by my ability. I actually had a patient yesterday from Maui, Hawaii. She was the chief technology officer of a huge technology company. And she got to the point where she had to quit her job because the demand professionally was not sustainable for her. She had to make a decision. And in our conversation, I asked, was that decision made against your will? And she's like, oh my gosh, Dr. Greg, I loved what I did. I was very good at it. But because I had a level of productivity that I knew I needed to do, I could not offer that. So you take that demand, and also respectfully, women that are in their mid-30s, they start to play with this thing called perimenopause, where the hormones start to think about menopause. They're still fertile. They can still have babies. But what happens is because of the shuttling and the movement of testosterone and estrogen and progesterone, it gets trickier. And it's very common. Think of like, so for example, progesterone is the brake pedal. And most of these women have been all gas and no brakes for most of their professional career. So then when they actually need that nurturing brake of the progesterone, the body's like, yeah, right. You told me to stop using that a long time ago, so that we see these imbalances. Now, the hope that I want to tell our listeners is you can test for these things and you can test appropriately inside of the cycle and timing. And there are very wonderful ways. Now, there's also a misconception in hormone replenishment or hormone replacement therapy. There was a huge study done in the 1990s. It was called the Women's Health Initiative. And this was the hope of this study was to prove that hormones could benefit the longevity and vitality of women through this chapter of their lives. And by the way, that study was ended because women were dying. So they just, so the conclusion was hormones are bad, close the book, end of chapter, done. Well, in the last 10 years, colleagues of mine have dug into the research of the Women's Health Initiative, and they realized that they were actually using synthetic hormones. And it was actually the synthetic, so a product called progestin, which is a synthetic progesterone, is actually known to cause cancer. So but then also the mindedness, the gospel inside of most Western medicine is we don't use hormones. They cause cancer. Well, as now there's this term called bioidentical hormones, which actually come from like Mexican wild yams. We actually know like bioidentical progesterone can actually prevent cancer. But because there's this disconnection in old, not well done research, it's really difficult for women to get good answers, good data, and take good steps to it. So again, if you're that professional that now has the heart of a mama and you want to be a mommy, don't lose hope. Don't
And
lose hope. And also lovingly, like you've gone hard for a long time. Your body needs nurture. Your body needs to be in a state of neurology and physiology that it can look around and say, it's a perfect time to have a baby. I have everything it takes to make a beautiful human being. And then not only that, then I have the ability to love and nurture and raise them how I want to.
Mhm. I love that you said that, because I think just the notion of, having to take mat leave, worrying about promotion, worrying about who's going to replace you, all those things really play on
Right.
women's mind and can really even push back the boundaries of age, because then you keep procrastinating, right? So just recently I had a client who kept pushing back, trying, and now she's found out that she's running out of eggs. So that's also a terrifying position to be in when you're there and you're finding out that you're really just trying out on your last hope.
It really is. And Charlene, this world is so much about what do you do? Tell me about your professional life. And I really think we've confused that with tell me about you, tell me about your heart, tell me about who you are. Many of us, our identity is in what we do.
Yeah.
And this world says, how big is it? How many? Tell me about your accolades. And it is a exhausting roller coaster.
Oh,
Um,
yes.
and you could write the book about it, my dear. Like that's the
I
reality of
am.
this.
I am
Yeah,
writing a
good
book
girl.
about
Oh,
it.
good for you. I can't wait to read that.
um, so I have an idea here. I'm thinking about sharing something about my personal life and just getting your take on it, because I know we've been talking about fertility and we've been talking about it from a different clients' perspective.
Yeah,
I was wondering if I could pick your brain
let's
on
go.
something that is actually very real in my life right now. How does
Yeah,
that sound?
I love it.
Okay. So, I'm not in my 20s, obviously. I'm fast approaching my 37th birthday.
Okay.
It's around the corner, and I'm actually getting married in 3.5 weeks.
Wow,
So I'm
congratulations.
really excited. Thank you very much. It's
Yeah,
very much around the corner, and my fiance and I are hoping to be trying for a baby after that.
love it.
And we've taken a lot of steps to make sure that I'm well and healthy, and we've gone through a lot of doctors and we've done all the check. I did know that 2 years ago I was struggling with hypothyroid. So my TSH was actually really elevated, but
Mm,
we've managed to bring that down. So
okay,
it's now roughly around like 1. It kind of goes up and down
okay.
between 1 and 2. And I am, I would like to think, really healthy. I work out regularly.
Mhm.
I eat well. I sleep well. But, I'm sure there is always a lot to improve. I do travel a lot for work and I do work a lot. So is there anything that you would say to a woman in
Great
my
question.
position to
All right, here we go.
start
We're
thinking
going to
about
dive in,
fertility?
girl.
There
Okay,
you
so
go.
let me ask some clarifying questions around
Sure.
what approach did you take to decrease your TSH? Did you take like Synthroid or levothyroxine, or what was
You're
the approach?
probably not going to like it. I feel like I'm going to reveal something scandalous live on the podcast.
Yeah,
Here goes. I bought desiccated thyroid that comes from bovine source because I didn't want to take medication.
love it.
So I
By the
did
way,
that.
that's what I. So here's the scoop. So the gold standard approach for an elevated TSH is levothyroxine or Synthroid. And by the way, I'm
Yes.
not diagnosing or undiagnosing.
Oh,
I'm
no,
just
no, no.
saying
I,
I'm
I,
just
I
talking
was
like
told.
direct basis, like my attorney talking. Um, but that's T4, and it's a synthetic
Yes.
form of T4. The reality is the number that our women need to look at on their labs is free T3. That is your bioavailable active thyroid hormone. So what you did is you took a naturally desiccated, probably grass-fed bovine thyroid from New
Yes.
Zealand. By the way, it's probably the same product I give my patients. And
Oh, so I don't feel so bad anymore.
so that product contains T1, T2, T3, and T4. So typically, so the medical range for a free T3, the normal range, by the way, I talk about a term that I call the sweet spot. And here, I also need to say this, I would rather you feel amazing versus have perfect labs, because many times optimal is so far from normal labs that it doesn't make sense. So what happened is, so you took T1, T2, T3, T4, and because you were supplying the actual T3 hormone, TSH, thyroid stimulating hormone, there was no need to stimulate, so that number dropped a bunch. Now, many times when women take the approach that you've taken and they take like these naturally desiccated hormones, many times they can look like they have hyperthyroidism because their TSH is so low and their T3 might be quote unquote so high. So they're doing this, they're feeling amazing, and they go to their general practitioner and they're like, oh my God, something's going on. I'm sending you to an endocrinologist. Like, you might have something going on. And the person's like, uh-oh, like, what happened here? So, but the reality is you feel great. So
Mhm.
here's the point. There is no research that says a quote unquote normal TSH is a normal functioning thyroid. So you need to look at free T3. And typically I have some patients that number has to get like 6, 7, 8, or 10 before they actually feel optimal. So by the way, good for you inside of that. But there are many hormones that we need to look at. So by the way, vitamin D is not a vitamin. It's a hormone, and it has so many intricate interactions throughout the body. It's something that you test for, but if you go get the test, the medical range will be like 30 to 100, depending upon what country you're in. But the sweet spot is about 80, is where you want that vitamin D. Another hormone is insulin. We've all potentially heard of the term like insulin resistance. And again, going back to the cell, remember that means that insulin can't get inside the cell to do what it's supposed to do because there's other things attached to that cell.
Mhm.
Melatonin is a hormone. We talked about the thyroid hormone, and this is where I would, if you were my patient, what I would consider for you is a test called a Dutch Plus test. And potentially, if you're looking to conceive, there's something called Dutch Plus with cycle mapping. So this is a test where you literally, so Dutch is an acronym, dried urine total comprehensive hormone. It's a urine test. And actually, estrogen and progesterone are most accurately measured in urine. Testosterone is most accurately measured in the blood. So
Mhm.
this particular test will not only tell us where your levels are, and we measure them, like for you would be during your luteal phase, so somewhere in like day 18 to 22, because we want to see very specific amounts of the sex hormones. But we also look at like where's your DHEA, which then converts into testosterone. By the way, testosterone converts into your estrogens. And then your estrogens have to be cleared by your liver. So if we're going back to this liver conversation, if the liver is burdened or stressed, there is a term called estrogen dominance, which isn't always a great thing to have around. So to be able to quantify that and make sure that those things are good. Now, the cycle mapping, so the first half of your cycle is very estrogen dominant. Estrogen is like the gas pedal. It's your body says, go. It's a lot of times when I have my female patients have more like vigorous workouts. The second half of the cycle is progesterone dominant. Progesterone's the brake pedal. It tells your body, settle down, chill. And why progesterone is dominant in the second half of the cycle is because your fertile window is around ovulation. So if you have conceived a baby, we need your nervous system, your body, to be in a state that it can nurture and grow that little one inside of you. So I would consider In your case, potentially looking at like a Dutch plus with cycle mapping. And then we can, because I've had women that have ovulated twice, which makes it really tough to get pregnant. I have women that, if they, in many, the most common hormone deficiency that I see in hard driving women is a lack of progesterone. And many women that are struggling with fertility have to take larger amounts of progesterone even to maintain the pregnancy. So progesterone is this beautiful, nurturing, baby providing hormone inside of the body. So I would consider that. And then obviously practices to soothe your nervous system. So I'm a huge fan of breath work. I'm actually formally trained by Wim Hof and his team. There's actually a direct correlation. There's a book called The Oxygen Advantage written by McEwen out of Australia. And in his book, he says there's a direct correlation with how long you can hold your breath and how robust your immune system is.
Yeah.
And if you think about it, if your body's all stressed out and you go to hold your breath, your body's going to be like, what are you doing? Please take a breath. Like, I'm stressed out. But if your nervous system is in a state of recovery and you're in that strong ventral sympathetic parasympathetic tone, then your body's like, cool. What are we going to learn here? So, by the way, congratulations on this upcoming wedding. I noticed that beautiful ring on your left hand.
Oh,
Beautiful, good work. And
thank you.
I'm encouraged for you guys. Also, we have hard driving women that set the stage, that call the shots. And sometimes getting pregnant isn't like that. So sometimes I have to educate my patients to stop having sex and start making love.
Yes.
Because they're like, let's go. I'm fertile. Come on. Like, whoa, wait, time out here. Like, so there can become this mental part of like, I'm a taskmaster and this is the time when we got to go, as opposed to that time is when progesterone is very, very dominant, which means it needs to be very soothing. It needs to be very, very in a nurtured state as well. Because I've worked with many, many patients who have been tried to get pregnant for years. And when they quote unquote gave up, they got pregnant because it was less of a task and more of loving on each other.
Yes. Do you think that this notion of making it like something to do, to tick off your box almost, because if you're a type A ambitious woman and you get to that phase of life where baby is now on the to-do item, and I'm sorry to use those terminology, I know
No,
that feels
you're right.
very, but it's often the case, right? It's like, okay, one more thing on my to-do, and by the way, the clock is running against me and my biology, so it adds that sense of stress. And then you're called a geriatric mother by your gynecologist, which is not very sexy.
And you're told that you are not optimal and we have to test for all these congenital things and you're high risk, which is a lie. I mean, I've had women into their mid 40s who have had beautiful, lovely, amazing pregnancies and got to be the mom that they wanted to be. So I really dislike the scare tactics of many people in Western medicine.
Can I tell you a few more things that I've been doing?
That's right.
So as you know, I follow a lot of your advice, and I've also been, quite involved in the biohacking community or the sort of health pioneering community. So I've done a couple of, I guess, biohacks, but I would love your take on it. I might have gone the wrong direction. So let's go and let's get raw feedback.
Okay.
Because of the connection between thyroid and liver, which I was aware of, I also thought, okay, let me go to the root cause and not just take the desiccated thyroid, and let's do things that could really help boost my liver health so that I
Like
can
the
also
families?
help my thyroid. So I've been taking TUDCA and milk thistle.
Yep. I thought you were going to go so far as saying you're going to do coffee enemas for your liver.
Oh, I have considered it, but I haven't done it.
So I'm formally trained in the Gershon cancer therapy method. I don't treat cancer in my practice, but Max Gershon, MD from Germany from the 1920s, he was very profound in affecting cancer, and he saw the liver association of and he found that coffee enemas were a very cool tool. So I've done coffee enemas with thousands and thousands of patients. I've never had an adverse reaction. So please don't go Google it. You're going to see all kinds of crazy things. Okay, so TUDCA. TUDCA is actually one of the bile salts that is produced by the liver. And the idea of TUDCA is trying to take some of the load off of the liver itself. It's saying, hey, because you're trying to deal with hormones and digestion and my thyroid, can I take that for you for a bit? So, by the way, you can test for levels of TUDCA in your body. And the most effective way is through a stool test. So I do a test called a gut zoomer, and it actually will measure bile salts in the body.
I did
What I
not
would
know that.
what I would say to that is TUDCA is not the most common deficiency I see when it comes to liver function. One of the things I do see a lot of like short chain fatty acid deficiencies, so the need for things like butyric acids. I see a lot of people, especially older, that are not breaking their foods down. You see, your stomach has many cells called parietal cells. And as we age, and I'm a lot older than you are, young lady, as we age, our stomach produces less acid. So many times need and too like ancient dietary practices use bitters a lot in their dietary approach, which is to acidify the stomach. So even things like hydrochloric acid, certain digestive enzymes can be of benefit. Did you say dandelion root as well? Was that your
Oh,
other?
milk
Milk
thistle.
thistle. Okay. Yeah.
Mhm.
So milk thistle as an herb does show liver supportive components. So yeah. The other thing, and I don't mean to gross you out, but because of the liver's filtration role, remember every 3 to 6 minutes, every drop of blood is going through your liver. If there is toxicity or pathology, infection in your body, the liver can be very overwhelmed with that. I also need to tell the clients, the listeners, that I joke like we don't have a hole under the right side of our rib cage where the liver is. The liver has to dump into the gut. So it dumps
Oh,
way up by your stomach through something called your ileum, and then way down by the exit point through your hemorrhoid vein. So if the gut has dysfunction, it can literally inhibit the liver's ability to drain appropriately. So we use a term called drainage, and drainage is just simply how I think God has designed things to get out of our body. And think of it like a funnel. At the bottom of the funnel is the gut, then the liver, then the kidneys, and then your lymphatic system, which is kind of like your oil filter in your body. And then it's your glymphatic system. Your brain, we now know, has its own lymphatic system. And then it's your sweat glands. And lastly, it's your respiratory system. Your body is always dumping things into that funnel. And if any one or multiple of those drainage pathways are not working appropriately, we can get an overflow of that funnel. And how that can present itself is acne, eczema, psoriasis, skin issues, skin sensitivities, because your skin is not a drainage pathway. Probably the most understood drainage pathway, and we talk a lot about this in our practice, is actually the respiratory system. If people have ever been exposed to environmental molds, for example, it's typically a respiratory response. In his book Breath, James Nestor talks about 8.2 out of every 10 pounds of weight loss is actually a gaseous exchange from the respiratory system. So he said, sorry, gym rats, you don't poop it out, you don't pee it out, you don't sweat it out. You have to be breathing properly. So that's why a breathwork practice, whether it's breath holding, whether it's doing specific work with the diaphragm, is absolutely crucial in optimizing your health function. So I like that you're doing those things. The liver is obviously very important, but as we're trying to refine, the question I would have is like, do you have parasites in your body? Do you have mold in your body? Do you have heavy metals? Because then, like, I am always intrigued when someone says, I'm doing a detox. And I'm like, oh, what are you toxic in? And how do you know that you're no longer toxic after you did your little whatever? Right. So we could just do better now. Now, also inside of that, Charlene, my goal is not to like overwhelm you with all of these things, right? You're doing so many good things. Your body um, is probably ready to be a mama. Women, the ability to understand ovulation is very important. Like, do you have a cervical mucus change? Do you monitor your temperature? Do you feel a middle schmerz, the release of the egg? Like these different things are really, really important. And there's all kinds of apps now and wearables that can help that. But that's a sign of being healthy, that your body says, I'm good. So I would like to assume that you're in a great place.
Oh, I'm so glad that you've mentioned all of this. I appreciate it. Now, I have a question, and this time is not for me. It's
Okay.
from one of our listener. I announced that I was going to have a conversation with Dr. Greg, and folks got really excited, and I got a couple of questions. So I was wondering if I could hit you with a bit of a live Q&A. How
Let's
does
do it.
that sound?
I love it.
So one of my client actually got recently diagnosed with non-alcoholic fatty liver disease, and
Yep.
she was stunned by the diagnosis. She feels very overwhelmed, and she kept saying to me, and I don't even drink.
Right.
So can you tell us whether this is getting more and more common, and could that be related to some of the toxins that she's exposed to in her household or elsewhere?
Oh boy. Again, we could do a weekend seminar on this. So NAFLD, non-alcoholic fatty liver syndrome, is becoming one of the much more diagnosed conditions of the body. And there's many ways to diagnose it. So liver enzymes, AST, ALT, alkaline phosphatase, albumin, GGT, uric acid. There's lots of words that people are probably like, holy cow, he just talks fast. But here's the thing. What the liver is doing is it's putting fatty deposits into its own tissue. And it's doing it because of the demand of what's being asked of it. So again, if we go back to the body responds appropriately to its environment, then, I wonder why my liver is responding this way. Like, what's going on? So in a case like that, yes, you don't have to drink a thing. Now, I'm not a fan. I don't drink. I'm not against drinking, but there are benefits of alcohol use in much moderation. But the reality is, could there be a toxic burden? Absolutely. Remember, every 3 to 6 minutes, every drop of blood is going through the liver. So if it's overwhelmed, it has to do something with those toxins. By the way, your body also will put toxins into your fat cells. So if you're not losing weight, it's because your body's like, I'm protecting you. Like I put these toxins into these fat cells and you don't get them because I'm protecting you. So with that person, we would also want to look at the thyroid. We'd want to look at her sex hormones. And then in Chinese medicine, they actually talk about how the liver, the liver and gallbladder emotionally are like anger and resentment.
Mhm.
Chinese medicine has emotions that are associated with those areas as well. Also, with that patient of yours, I would be curious of how is the gut? Because
Mhm.
remember, if the gut does not allow the liver to dump, the liver has to say, like, I guess I just have to deal with this by myself. So there could be some gut dysfunction. There could be some gut infection. The liver is easily, I've called it the most overworked, underpaid organ my entire career.
Okay, thank you. That was terrific. I really appreciate that. Next, I've been struggling to fall asleep for years. I used to take sleep medication, but I feel that it gets me to a place where I'm just drowsy the next day and I want to fall asleep more naturally. I can't do it on my own, but I found that melatonin really helps. I'm hearing pros and cons, and even people on social medias that says that it's not great to take every night. What's your take on melatonin to fall asleep?
Okay, so melatonin is a hormone.
Mhm.
And there's actually really good research on melatonin. Melatonin can be tested. By the way, that Dutch Plus test we talked about measures melatonin in the body. But if we back up 2 steps, if the body's responding appropriately, what's going on? It's not a lack of melatonin, just like a headache is not a lack of aspirin. Girl, what tell me about your day. Tell me about your evening routine. Are you staring at screens? Is there stressful conversations? Do you potentially live in a house that has mold in it, which is neuroexcitatory? Um, what is your bedtime routine look like? You could be progesterone deficient. Remember, progesterone's the brake pedal. And if we've burnt the candle at both ends for so long and you're all gas and no brake, then you're looking for a parachute to slow things down. So what I would say inside of that is number one, look at your day, look at your evening. Um, the nice thing about melatonin is it correlates well with even doing cortisol testing. So I like to test cortisol at several times throughout the day, and many times. So cortisol, it starts at a certain place, and then within 30 minutes, your cortisol should raise about 150%. So 30 minutes after you wake up is the most cortisol you should have all day long, and then slowly over the day, it should bell curve off to a very, very low amount. Well, when I measure people like the client you're talking about, many times I'll see this rise in the evening. So that person is what we call tired but wired. So they're tired, but they just can't wind down. There's things going on. And then they're using melatonin as more of a sleep aid than a hormone optimizer. So I am not shaming her for a millisecond to use melatonin. What my heart would say is, let's dig a little deeper.
Thank you. Yes, definitely. Very useful to know that. Okay, next. I am not on HRT yet, but I was reading the benefit of progesterone because I'm super stressed out and get anxious easily. So I bought some liquid progesterone online. I put it under my tongue, just falling asleep, and I find that it makes me feel a bit calmer. But I'm quite concerned about whether or not it is bioidentical and whether or not this is something that is safe to use, considering it was not prescribed.
That's a great question. So more than likely, it is a bioidentical form because it's not prescription, but depending on what country you're in, I don't know what the rules are of the country. So that is a very worthwhile research. What we have found is most over-the-counter mass-produced progesterone creams or liquids have a very unpredictable potency to them. So, for example, progesterone cream or wild yam cream is a very common thing. So, some colleagues of mine took progesterone cream and put it under a microscope. And they actually measured like the nanometer, the size of the particle, because the claim was it's absorbed and your body can use it. But the reality was it was too big. Your body could not even absorb that product. So, to your client taking oral progesterone, I love that they had a response to it, but the question would also be, yes, figure out is it bioidentical? It probably is, but then how many milligrams did you take, right? And also is that again, and two, like what I hear is like I need to slow down. I need my system to like chill out a little bit, and the hope is not, oh, just take this and you're good. The hope is always like, how'd you get here? Like what went on in your system that got you here? And because if we just give someone a something without the knowledge of how they got there, then are we really being a blessing to them? Or are we giving them like an excuse to keep driving hard and burning the candle at both ends? So, but it's very important. Progesterone can be a very, very beautiful tool when used appropriately at the right dose. And women that are still women before perimenopause, you should not be taking the same dosage all month long because remember, the first half of your cycle is estrogen dominant. The second half of your cycle is progesterone dominant. So that's where not that necessarily the fact that it doesn't come from a pharmacy, but what's the oversight? Who is educating you about the utilization and helping you with the dosage so that you know how it's actually supposed to work in the body?
Great. Terrific. Can we do one last one?
Let's go.
Okay. I work out quite a lot and I got into the habit of taking creatine in the morning and glycine at night. I found that creatine helps me with my training regimen and glycine is helping me to chill out in the evening. I've gotten used to this, but I don't know if I should cycle in and out or whether I can take this for the rest of my life.
That's a great question. By the way, good job for working out. It's very important. The body is designed, men and women, I think, should have a strength training routine. Now, also, we're not designed to work out hard 6 days a week. Like we have to understand our nervous system. So I'm a fan of using like heart rate variability and understanding the tone of the nervous system. I learned this working with professional athletes of like, what does your body say it needs today, not what is today's workout. So from that standpoint, okay, so creatine, great product, very safe. There are I personally, I lift weights quite a bit. I use creatine. I'm a very large man. I weigh 265 pounds. I'm not sure what that is in kilos, a lot. And so I take about 10 grams a day of creatine on the days that I work out. So it is shown to help with muscle building. It is shown to help with muscle recovery, but it will have you retain a little bit of water. So be mindful that if you're like, oh my gosh, what's happening to me? Creatine can do that. Also, it can potentially alter some of your kidney labs because of the process. So creatinine, which is different than creatine, but creatinine on your lab could show mild elevation with the use of creatine, but it is a good tool. My wife uses it. My kids that are of age of lifting weights use it as well. And then what was it, glycine that they used in the evening? The
Glycine.
amino acid. Okay,
Yes.
so creatine and glycine are just amino acids, right? They're breakdowns of proteins, and glycine is very safe. It's easily utilizable. There's not a toxic level inside of the body, and if you feel that it helps you, whether it's from the actual product or there's placebo or a little bit of both, I think it's just fine. My heart would be also just continue to listen to your body and what it needs from a workout standpoint.
Okay. So do you personally cycle in and out of creatine? Because you're saying you use it as well when you lift weight. Do you
Yep.
take it only on the day you lift and then you take a break when you're not
Yep.
lifting? And you do that continuously?
Yes, I do.
Okay.
Yep. And there are different forms of creatine. So depending upon where you live, there's a like a trademark called CreaPure. And I feel that it's a little bit more bioavailable. It's just a touch more expensive. If you're listening to this in the United States, there's a company called NutriCost, and they do such their stuff is so reasonably priced. Don't buy premium creatine, please. Don't spend extra money. Like it's not now. Now there are other tools from a working out standpoint that can show some benefits, but don't buy fancy creatine. It's just not worth it.
Great. Dr. Greg, I'm so grateful for all your insights. If somebody has listening today and really wants to work with you and become your patient, how can they do that?
Yeah, so you can go to our website. It's vitaefm, vitaefm.com. There's a simple way to sign up inside of there. We're typically pretty busy, so be patient. It's like if you go to a restaurant and on a Saturday night and there's every table open, that's not a good sign. You want that, so you can check us out there. What I would ask people to start though is just go follow me online. I have a mission to just educate people, so it's Dr. Greg Health on Instagram and TikTok. My heart is just to bless people and love on them. And you can interact with myself and my team online. We love just chatting with people and answer any questions that you might have.
Thank you so much, Dr. Greg. I enjoyed this thoroughly and I'm so grateful for your time.
I
Thank you.
appreciate it. Thank you so much for your time as well.